Thanks again, Connie.
Welcome, everyone. We'll start in a few minutes. All right, so good evening and welcome to tonight's live virtual program. I'm Amber from the Reference and Adult Services Department here at the library. Thank you for joining us this evening. I have a few housekeeping items to share before we start the presentation. Tonight's program is scheduled to run until 8 p.m. During the program, all attendees will be muted, so report any technical issues you may have in the chat. Chat messages will only be visible to the hosts. There will be a Q&A session after the presentation, so if you have a question, please enter at that time in the chat. We'll address as many audience questions as we can before the program ends. Tonight's program is also being recorded and will be available to watch on the Library and the League of Women Voters YouTube channel shortly after the program in a few days. And without further ado, I'll turn things over to Ellen Lafferty.
Thank you, Amber. Good evening, everyone, and thank you for joining us tonight. It's great to be back and partnering with the Howell Carnegie Library and presenting informational programs to the Livingston County public. I'd like to introduce my co-presenter and Director of Program Planning for the Livingston County League, Claire Donovan. You'll see her tonight as well as myself moderating. And for those of you who are new to our public programs, the League of Women Voters of Livingston County is very proud to be nonpartisan and a nonprofit organization. We neither support nor oppose candidates or political parties at any level of government, but we're always working on vital issues of concern to our members and to Livingston County public. You can follow our ongoing work of the League by going to our website, lwvoflivingstoncounty.org, or by following us on Facebook. And I want to take a quick moment to thank the Howell Carnegie Library and especially Amber for making this virtual program platform available for everyone. As she has said, if there's any questions that you might have, please put them in the chat and we'll definitely open it up for questions at the very end. And just a little background on this, the social policy position of the League of Women Voters supports a basic level of quality healthcare that is affordable and available to all Michigan residents, including mental health coverage and services. With that being said, the League is grateful to have as our guest tonight, the Executive Director of Livingston County Community Mental Health, Connie Conklin. Thank you for joining us tonight, Connie. I'll turn it over to you.
Okay, I will share my screen now. All right. Sorry, here we go. Good evening. As you mentioned, my name is Connie Conklin. I'm the Executive Director of Livingston County Community Mental Health. I have been in this position for 11 and a half years. In Livingston County, I worked at the state level for 14 years. I started the beginning of my career in Livingston County Community Mental Health working in children's services. So I've worked in the public mental health system for 37 years. Makes me seem really old. And this is, I'm not used to doing Zoom presentations, so I will do my best to know that there's people out there. But it is a little challenging for me, so that's my little disclaimer. So I'm just going to go right into this presentation, and I'm going to hit on most of this, but I do want to make sure I leave time for questions and answers too. So I just want to give some background around mental health. 1 in 5 adults in America experience some kind of mental illness. Just over 20%, or 1 in 5 children, have a debilitating mental health condition, which means they have difficulty at home, school, community, navigating kind of the basic day-to-day type situations. And that's increased in the last probably 5 years, somewhat more. 1/2 of all chronic mental illness begins at the age of 14, 3/4 by the age of 24. You probably have maybe heard that some individuals may experience kind of a significant mental health issue like schizophrenia or something that is more of a serious mental illness in the early 20s is kind of the onset of some of the where you're going to see more prevalence of significant mental health issues. Diagnosis of ADHD, anxiety, and depression become more common with increased age. I've never been a huge fan of diagnosing kids too young with serious mental health issues. I think it's important to kind of, there's a lot of personality things and developmental things that are normal for kids. And so I'm always a little cautious about, let's see how some things when I work with parents, let's see how some of this plays out and affects functioning, because sometimes it looks like or ADHD, or sometimes it's autism or something else, and you really want to see how a child develops before you give them a significant diagnosis without a lot of diagnostic testing. Behavior problems are more common around children ages 6 to 11. Some kids may have some pretty significant behavioral issues that they do grow out of, and is not necessarily an inherent mental health issue. Sometimes it's frustration. Sometimes kids have hearing difficulties that nobody knows about, or visual or health conditions that can exacerbate behavior. More than 50% will be diagnosed with a mental illness at some point in their lifetime. I think that if I ask people, do you know anyone that has a mental health condition? A lot of people would say, yeah, they do know someone, or they have experienced that. It's a lot more common that people struggle and are challenged. Some of the causes of mental illness, it's complicated. Some, are contributed to early experiences and trauma. And I think one of the things about that is kids can recalibrate their brains if they have trauma early on, that you can teach your brain a different way of coping, a different way of experience in the world. It doesn't mean that those things didn't happen. It just means that there is hope that kids and adults can learn how to cope with some of that trauma. It could be chronic medical conditions, things that I've worked with kids before and adults that have blood sugar problems that are undiagnosed that create a lot of variance, with how people act. And I think those are things that they don't have to be big medical conditions that can really present as some mental health issues. So there's also, the brain is a very complicated organ and tool, and we all process information differently, and I think those all have things an impact. Alcohol and drug use. I think one of the things that we see more now is some of the impacts of some of the synthetic drugs that are out there, and the impact that has, and how we have people that have presented as psychotic and they're on a synthetic. And so that makes it really complicated. And how do you treat that? Because you may not know that on the surface. And so those are some of the challenges. Depression is more common than AIDS, cancer, and diabetes combined. And I think that's pretty impactful when people think about it. The impact of COVID on both children and adults' mental health has been dramatic. And there's a lot of data coming out. When we looked at our inpatient screenings that we do for people coming in for crisis appointments, and we saw from 2019 to 2020, 21, we saw an increase of adults coming in at 399%. And for kids, it was an increase of 344%. So there was a lot of impact that it had, that COVID had. It's not necessarily the COVID health part, but there were many other factors around fear. There were scarce resources that were available. routines were disrupted. So if you think about this morning when you got out of bed, you probably had a very specific routine that you followed. And when somebody puts a stop button and you don't know when you're going to start again, that sense of security around that does create a lot of fear and instability that I think people weren't aware of and didn't anticipate. And then just the grief and loss of life that was out there. I'm just going to hit on a couple of these points around with COVID there was more awareness of mental health, which I think has been good to reduce some of the stigma, that it was a lot of people were experiencing anxiety and depression. That part's not good, but the fact that people were talking about it was positive. I already talked about some of this. I'm going to talk a little more detail later about, we work with all of our law enforcement agencies in the county. So all the city and township police and sheriff's department, they can, if they go out on a call and they don't arrest somebody, but they're the first responders a lot of times for mental health. And if they go out on a call and they're not necessarily going to arrest somebody, but they're worried about them, they can make a referral to us and then we do outreach. Doesn't mean that everybody engages with us, but we'll at least reach out to people that maybe are struggling. We provide mental health first aid training, both youth and adult, to the community. And we're doing a lot more kind of outreach and wellness type of activities and classes to the larger community. The other thing is we have seen an increase in substance use and overdoses in our county. And that is continuing to be, unfortunately, the trend. Other impacts of mental health is access to technology and information can be overwhelming. And I don't know the ages of people around here, so I'll just speak for myself. I know that when I was younger, you didn't find out stuff. You might have found out years later, and there were scary things, but you didn't know about it. You didn't have access to that kind of information. Now there's a lot more access to information, some of which can be pretty traumatic. And kids, especially with kids, they don't process information in the same way. They don't have the same brain development. They are not many adults, despite that they look older. Their brains are still not developed until they're in their 20s. And so having access to too much information isn't necessarily good. And information that just because it's out there doesn't mean it's accurate and factual. So, taking kind of news breaks and those kinds of things are important. And I think I just want to hit on some of these points. Social media overall, it can be a positive thing, but it can also be a search for validation and false connections that I think has challenged people. And it can be a platform for not good things too, which then creates kind of more social isolation or living in whatever people are interested in, or just seeing one side of something. I think those are kind of the big things that I would hit on with regard to that. Now I'm going to kind of switch gears a little bit and talk about Livingston County Community Mental Health and kind of what our purpose and vision is in the county. So our purpose is to create individualized pathways to wellness, resilience, recovery, and self-determination. So what that's about is everybody has their own story. They may have a diagnosis, but it looks different in everybody. And so you really want to meet people wherever they are on an individual basis and create a plan that works for them, not what other people think it should look like. And we really want to have a healthy and rewarding life for everybody in our community and really try to strive for those things. I'm not going to go into great detail on some of these, but I think one of the things is we are the safety net provider for mental health in our county and our community. That doesn't mean that other agencies don't do work, but if anybody's in a crisis and they need something, we must serve them as a community mental health agency in a crisis situation. It may not be long-term, but we do crisis intervention all the time. And we do that with welcoming everybody and in really trying to respond to that. I think one of the big movements that we've had around integrated care is that making sure that people have primary care. You know, a lot of people that we served use the emergency department or more crisis kind of urgent care type situations versus having a doctor. And one of the things that we try to do is make sure that people have doctors that provide the health care throughout their life and that they're not over reliant on kind of emergent care. The good thing about Livingston County is that we collaborate and we really try to work together. We try not to duplicate our efforts, but you know, one agency may be good at something and they're going to take the lead on it. And then there's another agency that'll take a lead on something else, and really believing that we want to get the most out of our resources that we have and not duplicate efforts. We want to really strive and focus on people's strengths, needs, and abilities, and not focus on disabilities and overemphasis on diagnostic. You know, one of the things about diagnosis helps us understand people, but an individual approach is always going to be the most successful, where you're looking at the person across from you and you're asking what they want their life to look like, and then you're trying to make that happen and help them understand how having significant depression or anxiety or schizophrenia may have an impact on that, or autism, or whatever it may be. So Livingston County Community Mental Health, we serve the lifespan. So we have an infant mental health program where we work with moms and their babies all the way to our senior services. We work with children and adults with mental health needs, children and adults with intellectual and developmental disabilities, and that it would include autism, children and adults with substance use needs. And we typically are going to serve children and adults with the highest needs. Our primary fund source, our funding is Medicaid and Healthy Michigan and some Medicare. So 86% of our funding is federal. So it's within Medicaid and Healthy Michigan. 3% of our funding we get from the state. So we do not get a large amount from the state, and we get about 1% of our overall budget is local dollars. And then the other 10% is grants and other services kind of fill the gaps. I mentioned we are the safety net provider for crisis services. Children and adults with more mild and moderate conditions are often not eligible for our services, and we would then refer them to a private provider or a nonprofit provider, depending on what that is. We do provide some, again, immediate type services if somebody's in crisis, as kind of a way to then transition them to another provider. But we may not be the long-term provider for that person. We have two main locations for mental health. Our 2280 East Grand River CMH building is our main intake and crisis. And that is located, I'm into Landmark. So it's located by the Aldi's in the county complex. And that's where we have our main intake and crisis services. So if somebody walks into that building, we will see them. It's typically better if we have an appointment, but if someone's in crisis, they can walk in and we will do a crisis intervention. Our other main building is 622 East Grand River, and that is our children's services and our administrative offices, and that's across from the Howell Police right on Grand River. We also have a program that runs 24 hours a day, 7 days a week, 365 days a year. That's called our Personal Emergency Response System, and it's an auto monitoring system. So we have a monitor that's placed in a consumer's home to provide support in case of an emergency. We also remind people to take their medication. So this is somebody who can live independently, but may have additional needs, but doesn't need to have staff there 24/7. And so we provide that service. And I'm going to click here and show you a picture, because this is our room. And a lot of people don't know that we provide this service because it is specific to our agency, but it allows people to live independently. And families know that we're monitoring and calling in and checking on them. It might be somebody who has a seizure disorder, and we have people in that room that are listening. And if we don't hear something or we hear something different, we will call 911 or we will run out there. We have runner staff that has access to the consumers' apartments, and we can run and check on them. We provide this service to Washtenaw, Monroe, and Lenawee, and Livingston counties, just within this location. So it's kind of a unique program. There aren't many around the state. There's, I think, maybe two more around the state. And again, it allows people to not have staff in their home 24 hours, but they do need some support. They need, did you take your medication? And everybody, each person, you'll see those folders in front of the phones. Those are their treatment plan. So every person kind of has their own plan or need of support. Many are not on there 24/7. Some are, but some just are on when they come home from a work program or work or something, and then they're on that. So it's just a kind of a unique program that we do provide. We also have other programs in the county. So Stepping Stones Engagement Center. It's a substance recovery center. It's located at 2020 East Grand River. Again, it's by El Patron. Some people know that there's a blue awning, and by Catholic Charities. There's a blue awning side entrance. The hours of operation is 4 o'clock at night until 8 in the morning, Monday through Friday. And then it's open 24 hours on the weekends. And this is for anybody can walk in who's struggling with substance use. You could have private insurance, you could have no insurance, you could have Medicaid. It is one of our programs where it doesn't matter what insurance you have, you can always come there. Now the services after that, if you need to get into detox or something else, we would just work with that person to get them in, depending on what their insurance might be, or try to help them navigate that. But it is again, a resource to anyone in our county. Genesis Clubhouse is located, it's not located in Fowlerville. I updated the slide, I don't know what happened. But we did move by Planet Fitness, and it is open mostly during the week, and it's specific to people we serve. It's not kind of open to anyone like the Stepping Stones Engagement Center. It's part of our service array. And then Heather Oaks is a consumer-run drop-in center by Hooks Carpet. And that is literally a drop-in center that's run by consumers. Many of our consumers have needs that require to support their quality of life. So they may come to us and they're struggling with housing, food insecurity, transportation, employment, family relationships. It's typically more complex needs, more significant needs that we're helping navigate. It's not just somebody comes in for an hour session type of treatment. There's a lot more that goes into that. We work very closely with other serving systems like specialty courts, Department of Health and Human Services, schools, private providers, healthcare providers. So again, really trying to get the most out of the services. And we do a lot with transitional employment, really try to help people who may have been isolated make connections and Genesis House is probably one of our biggest programs that deal with kind of an employment, and we have a different transitional employment for people who may not have been in the workforce or have not been in the workforce for many years. Most of our services are provided to consumers out in the community, especially our children's services, but a lot of our adult services where we go to people's homes, we go to school, we go to the community, we go where people are and work with them, especially, again, with our children's services. We do a lot of outreach in families' homes. Our services are voluntary, although some of the consumers may be involved with the legal system or have alternative treatment orders that we monitor with the court. So they've been petitioned, and then we follow and work with them. We have 5 group homes in the community that serve consumers. Many have intellectual and developmental disabilities. I think people don't know because they're just out in the community, unless you're our neighbors, which our neighbors like us a lot. Then you may not even know, because they're just out in the community. They're 6-bed homes, and we have 5 of them. We also place individuals in specialized residential if they need that level of care. We really believe in community-based care and having people live in the community. Sometimes the risk is too high, either for themselves or others, so they may have to go into a more specialized residential, and then we're trying to work to get them into a lower level of care, least restrictive level of care. We authorize psychiatric hospitalization for children and adults if necessary. So again, we would authorize somebody who has Medicaid, Medicare, or no insurance. We also authorize all substance use services, including detox, residential, outpatient, psychiatry, medication-assisted treatment as well. And again, that's primarily the Medicaid and Healthy Michigan population. There's others as well that we have some grant funding for substance use that we can provide services to. We also have other grants that serve kind of a larger population. We have some senior services where we do some outreach. And again, we work with other agencies on some of that. We have a newer program which is health homes, and that's for some of our consumers that have significant health conditions as well as mental health conditions. And so working with specialists in primary care, we have a nurse practitioner that kind of leads that. And it allows kind of better access to care with that particular program. We have our jail diversion, where we kind of monitor people who may come in that get put in, that are in jail because of something, but they may need to go into a hospital setting or something else. And so we work to try to get them to where they need to be. Again, it's going to depend on what they're in jail for, of whether or not we can divert them or not. Not everybody can be diverted. I mentioned that we receive law enforcement referrals directly from our county law enforcement, and again, we get them from, and it's really expanded the amount of referrals that we're getting across our county. And originally, it was the larger police departments, and now we're getting them from the township polices, and so it's really expanded. And the good part about that is it allows law enforcement who are worried about people when they go out and they're not sure what to do, and they can give them a phone number and they can give them a card, and this way they can also reach out to us, and then we reach out with specific information of how they may access care. It doesn't mean that they have to, they're not required to because law enforcement gave us a referral. It's just a way that we can maybe help somebody who's in crisis. And what I'll say about that is we really saw an increase specifically of law enforcement maybe going out, or EMS or somebody, and having a senior that was living alone now because their partner, wife, husband, wife, whoever died, and they did some of the daily things that, whether it's grocery shopping or something else, and they were pretty isolated, and somebody was worried about them enough, and that's a way that we can then do some outreach. And so that those are kind of the examples where they may get called out a lot to a specific home. And if we can engage them and try to get them the support they need, and sometimes it's not, mental health services. It could be housing services. We'll just direct them to where they need to go. But I think that's an important piece. In the last year, we joined the Livingston Regional Crisis Negotiation Team, law enforcement. So when there's, whether it's a SWAT team or the negotiation team goes out because there's a situation, whether it's a barricaded person or something, we now have social workers that are part of that team with law enforcement that can help with the negotiation process. And that's been a very nice partnership. And again, it's not just with the sheriff's offices, with other police departments as well. We also provide crisis critical incident stress debriefing. And that's where, if there's a situation in the public, so if there's something that happens where there's a lot of community members that are witnesses to a traumatic event, we can do critical incident debriefing with those citizens. So typically law enforcement will do the critical incident debriefing with law enforcement and EMS and those things, and then we could do the community members. And so again, we have, there's folks at CMH, but there's also members of LASA, the Intermediate School District, that are part of that team. So they're part of our community team. So we do that collaboratively. We also have other grants for outreach. I mentioned the youth and adult mental health first aid. We've been doing more podcasts and supportive classes for just community members, that just informational type things that we can expand our reach a little bit. And then we also facilitate the survivor suicide group that meets monthly as well. This is a new resource in the last few months that we put together. And again, it was with our Human Service Collaborative body. And it's specific around the different resources for substance use and mental health in Livingston County. And it's not just the public, there's private, there's what should you ask, what should you, those kinds of things, so you can navigate. It helps hopefully navigate some of those, I'm not sure where to go, I'm not sure what to do. It's a resource, and we have many copies of this. So if anybody wants actual hard copies, let me know and I will make sure you get some. But here are links to those resource guides that are part of the PowerPoint. And then with that, I am ready for questions and answers. So I will turn it back over.
I love your final page. It's adorable.
Yeah, those are my babies. So I'm going to stop sharing, right?
Yes, if you don't mind.
Sure.
All right, beautiful. Okay, thank you. There was quite a bit of information there. Thank you so much. And I'm going to open it up to whoever. I don't know if any questions were presented in the chat. Amber, do you have that?
I haven't seen any questions. There haven't been any questions yet.
So if anybody would like to unmute themselves and share their video, you're welcome to right now, and ask your question directly. That is just fine if you choose to do that. In the meantime, I just have a question myself, having worked in Brighton area schools. How are you in some youth that, we just wanted some help for? Your referrals, you mentioned, do you have referrals from the schools then, parents, and so forth? And the fact that you're covered under Medicaid, is there a qualification process to get them qualified for Medicaid services before they are able to receive your assistance?
Yeah, so people would have to go to the Department of Health and Human Services, which is over in the East Complex, to fill out the application to get on Medicaid. That isn't the only way that, I mean, especially with kids services, we have some blended funding and some other options that our doors a little bit wider for kids because we collaborate with other agencies, the schools, the courts, DHS. And so we can expand our reach somewhat for people or for kids that have some significant needs. And then what's the other part of your question?
Oh, just if they have to qualify for the Medicaid first before they receive any kind of assistance. And not only that, but I also asked about referrals from not only altercations that might have with the legal system, but also with homes or schools. I mean, where do your referrals mainly come from?
We get a lot of referrals. I mean, prompting from schools for parents to bring kids to CMH. So I would say a lot of our probably children referrals come at the suggestion of schools. But I think it's parents are worried about their kids and they don't know what to do, and so they bring them in. And I think one of the things is if somebody's in crisis and they need us to see somebody, we will see them. But if they have private insurance, then we have to navigate them to whatever the private providers are because we can't provide services longer term. When I think when a lot of people were shut down because of COVID, we were open the whole time, and so we saw a lot of people. We just had to do what we had to do, and I think other agencies did that as well. But I think that's one of the pieces is making sure that we have a provider network for everybody. And there's some kids or some adults that need our services that have private insurance, and it's a barrier. It just is. I'm not going to say that it's not, because it is.
Yeah.
With kids, we have a way of serving some kids that do have private insurance, depending on the level of need.
But it is a challenge sometimes.
Sounds it.
There's a
We
few
have
questions in the chat. I see one that says, are there plans to offer youth mental health first aid? And how about offering any AFSP programs?
We do offer youth mental health first aid. So we've trained several people on youth mental health first aid. We've had some community trainings that are open to anybody. And so we can provide that as well as adult mental health first aid. And then what was the other part of that?
How about offering any AFSP programs?
Is that suicide prevention? Is that what?
Maybe.
Yeah.
Yes. Yeah, they said yes.
Yeah. I mean, we do suicide prevention activities, but there's a lot of different kinds of suicide prevention that happens as part of our service array, but it's not, I don't know if there's a specific curriculum. I mean, we work with them on the suicide survivor, and we do a lot of we try to do as much education as we can around suicide prevention, but without knowing a little more about what you're looking for, I'm not sure. We'd partner with them on a couple different activities, but.
Did you have another question, Amber?
Yeah, there's one. Is the new St. Joe Hospital going to offer any mental health services?
I hope so. I mean, we're working pretty closely with them around, and they're in the midst of their their needs assessment, and the preliminary needs assessment is mental health is their number one priority. So, and I think we've been working closer, I would say, in the last couple of years because of the access issue around psychiatric hospital beds, the crisis that we have for both access to children's psychiatric beds as well as adult psychiatric beds, but really significant access problem. So you have kids in the emergency room waiting for a bed that doesn't exist. And so that's kind of rose the crisis point significantly to where, and we've always worked with the hospitals, but I would say we're a lot closer partners than we've ever been because of some of the needs that we're seeing.
That's what I was wondering, Connie, because that was my question. And I was wondering if it was going to have any in-house services like that, if there was going to be a wing or if they're designating any area in the hospital at this point in time.
I think there's talk. I don't know. I'm not going to speak for them, but I think they know that there's needs. I mean, we do have a couple projects that I didn't mention. That Project Assert, which is where we have a peer in the emergency room that can do outreach specific around substance use. So if somebody comes in for substance use in the emergency room and then gets put on a medical floor, we'll go and do outreach, or we'll do outreach within the emergency department as well.
Connie, you mentioned the rise in COVID-19 having such a significant increase of the folks seeking your help. Did funding increase as a result of COVID-19 because your Medicaid supported 99%, I think you said, or a high percent, 90%. But does, for example, significant increases of COVID-19 or drug overdoses and that, is there any kind of reflection in funding that increases, that acknowledges that we have this problem that's increasing? So let's put the support behind it.
Yeah, I think in the midst, in the middle of it, like when it started, we got an influx of funding that we just could do what we needed to do. Unfortunately, there's the beginning and the end of COVID, and then there's the after effects of just and again, whether or not, however you feel about was COVID real or was a health thing or not, it impacted how we lived our lives, which impacts our mental health. And so I think there's lasting effects of that I kind of feel just how people interact with people is very different than it used to be, where it's, I think we're turning around a little bit, but I think that has an impact on people being on edge so it, unfortunately, much of that funding and our ability to do those things has ended. And that's the part that it's not ending, but it's ended because the health part of it, but then there's the other pieces of it that I talked about that, continue on.
Okay, is there anyone else in the audience that has a question right now? I guess I always want to ask a magic wand question. If you had a magic wand that you felt would be the best form of support that the community could provide, or the state, the nation, I don't know how to phrase this, but do you see anything that would just help alleviate the increase of mental health issues that you're experiencing, challenges?
Well, I think there's kind of the immediate one around workforce issues and not having enough social workers to do the work. Because I think there's a lot of really good initiatives out there and a lot of cool things that would make the significant impact, but we're limited with the number of people that we have that are in the field. And I think that's one component of it. I think the other is just around the stigma part of a lot of people experience challenges, and there's ebbs and flows to that. And just being kind of, I mean, I guess it's very simplistic, but just being, you don't know people's story. You don't know what people go through every day. And just being able to have people approach people in that kind of way where you're just a little more patient around the story that goes with the person who's annoying you somewhere, or just kind of a kinder, more accepting world about how we navigate it, and that people have varying abilities, that our brains are very unique, and again, how you process it, how you process information is totally unique. How you learn is totally unique. And that means what we do and how we approach people should be unique as well. We shouldn't say, okay, you have this diagnosis, you go in this door, you do this. It's like, what does this look like for you? What do you want it to look like for you? And then you create kind of that. And unfortunately, when you're working in kind of a governmental regulated situation, you don't always get that flexibility. So that's why we write grants, so we can do kind of cooler stuff that, not that it doesn't have rules, but that it allows that strength-based approach, that it's like, whatever it takes, we'll figure it out. And nobody wants to say no to people. And I want to be able to serve whoever comes in our door, but I know I can't. And that's frustrating.
Connie,
Okay,
I
thank
just
you
had a
for
quick,
that.
yes, thank you. I had a quick question too, that as the organization League of Women Voters and anybody else here that might represent an organization, what can we do to support you and your department? Because that's ultimately why we're doing these public education forums, is because we really want to show Livingston County, first of all, how blessed we are to have people like yourself and such qualified people in these public positions. But what can we do to support you or your organization?
I think advocating for the things that make sense for people, like it's pretty common sense to me, is that if we want people, well, mental health parity. Michigan does not have mental health parity, which means that people can't have the same access to the same type of care, and that we're one of the only states that does not have that. That legislation's out there. That would be, I work really closely with our senators and our representatives on this stuff, and they're very good and receptive around that. But I think those are things that it shouldn't be such a fight for people to get the care that they need for their brain, their health, mental health, whatever. It should just be easier, and it's just not. So those are things, again, I would love to be able to open the door. And again, there's a lot of good other agencies out there in our community that provide great services. And there's plenty of work for all of us. But being able to just kind of open our doors and be more responsive, because our funding shouldn't drive all of this. We should have a wider safety net than what we have.
We have a comment related to that in the chat that says the Livingston area pet pantry is here to support CMH. Just today, we provided emergency pet food through a referral from CMH. We're proud to continue to offer this support.
Always do. We appreciate that. Yeah, I mean, that's one of the great things, is it's so much bigger than mental health. It's all of the other agencies and support. There's gleaners, there's food banks, there's churches, there's everybody. And in this community, I mean, I grew up in this county, so I've lived here most of my life. And so I think it's nice to be part of a community that is responsive and cares a lot about the people that live here. And you know, we're kind of a let's figure it out community, which you don't always get, kind of a sweet spot of a size that can do that. And you know, it's not that common that you're going to have the sheriff who's will do stuff, and you're going to have other agencies that will just be responsive and okay, what do we need? Let's figure it out. Let's do it. And try to break some of those barriers.
It sounds like not only do the individuals need support, but I'm sure your program encompasses the family members that are.
Oh, absolutely.
Oh yeah, it's just coming from the schools. It's not just the child. It's their village, you know, that's affected by the challenges, whether it be mental health, addictions, so forth. We've all walked that walk.
Yeah, we have a strong NAMI in our county. It's the National Alliance for the Mentally Ill, and that in Livingston County, they have meetings regularly, and they're a big support.
Nice. Connie, you have given us so much information tonight, and to those who are here tonight and who are listening to it later on, we're going to try to follow up with an email, not only with a PDF of Connie's presentation tonight, but also links. If you could provide us with those links to that family support, to all of that, and we're no rush to get that email out. If you could allow us or provide us with that information, that would just be extremely helpful. And I'm sure everyone on this meeting tonight knows someone that would benefit from the conversation that you shared with us tonight. And thank you for that. I really appreciate that.
Sure.
Claire, did you have anything else to add at this time? I think I lost Claire.
Connie, I think it's just amazing. And you're another division or something or organization in our county. The collaboration, it seems, that takes place in Livingston County is what we continue to hear over and over again through public transportation forums that we've had, road commission. I mean, I'm always just really encouraged and just appreciate all the beautiful people that we have that work in this county. Thank you. Thank you so much. And just know how much we really appreciate everything that you guys do.
Thanks.
Okay.
Mm-hmm.
I want to thank you again for joining us this evening and sharing your important work of Livingston County's CMH, another acronym for us to remember. And again, we're going to have that follow-up email. And right now, then, I'm going to turn it over to Amber, who's going to wrap it up for us tonight.
All right. Thank you so much for that informative presentation. And thank you all for attending tonight's program. We hope you enjoyed it. If you could take a few minutes to tell us what you thought about this program in a short event evaluation that I linked in the chat, and I'll also include that link in an email, the follow-up email. You can visit our website, www.howelllibrary.org, to discover more upcoming events from the Howell Carnegie District Library. Good night, everyone.
Night.